Workforce planning and development is a critical board issue, and probably the primary reason is that workforce is involved in everything we do to provide high quality and safe care, therefore the mission of the hospital or health system. So the board, of course, needs to be involved with that. You think about the convergence of drivers like new market entrants, behavioral health shortages, rural health challenges in terms of workforce, chronic disease burden, all the technological changes, that workforce is at the center of all of those things. So the board is really responsible for convening those conversations with management to be thinking about the future, taking a look at the kinds of strategic issues that link with HR capabilities, the roles and skills and competencies that are needed for the future. So it's an essential board responsibility. I think the primary way that boards ensure that hospitals and health systems have an adequate workforce is through the strategic planning process. That typically we've thought about human resources as more of an operational perspective, but we know it's incredibly important that the strategic implications of workforce are really integrated into any strategic planning. So for example, thinking about what are the strategic commitments of the hospital and health system, and then ensuring that the HR capabilities are really addressed together. I think also boards can take a look at the community health needs assessment for their community and really letting that information inform both current and future workforce issues. Certainly asking good strategic questions. Do we have the data and analytics that might help us think about workforce? Sometimes we need to look outside the organization for that information to other partners, state workforce groups, for example. Asking, have we made adequate investments? Does our budget reflect an appropriate investment in terms of workforce development, both currently and in the future? Do we have adequate leadership? Do we have leadership for the future that we need? What's the bench strength? What are the strengths that are going to be required in the new kind of healthcare systems that we're designing? And I think ultimately putting, a focus, a light, if you will, on this issue through board agendas and ensuring that we're having these conversations with our partners. First, our current workforce is not going to be prepared to take on the new work that we need to take on in terms of new sites of care as we think about working more in the community. There's a lot of change management that's involved with our current workforce, and if we're not already thinking about that, they're not going to be well prepared, and of course the mission's not going to be met. I think the other risk when we think about population health initiatives, we're putting a lot of strategies together, and we have to think about who's going to be doing that work, and that may be people that we're currently thinking about in our organizations, but other kinds of folks, wellness coaches and other kind of lay workers who might be extending our professional staff. So again, ultimately the risk is not fulfilling the mission, which is a critical issue for all boards to be paying attention to, so both for current workforce and for the future.